Right now, each of you are here and you're tasked to speaking to your legislators and reminding them just what we can do for the healthcare here in Florida. Today, 40% of all Floridians are either underinsured or uninsured, and those numbers are unacceptable. Senate Bill 188 and House Bill 677, they need to be put forward, they need to be heard, but most of all, our legislators need to hear from you.
This is just not a one-day fight. This is for the future of healthcare in the state of Florida. We need your help, okay? You've got some strong forces on the other side. In the Senate, I need Senator Gates to hear our bill. In the House, we need Representative Nick Thompson to hear the bill.
Stress to them that giving nurse practitioners prescribing authority for controlled substances will cut down on health costs, trips to the emergency rooms, and increase access to health care. Go for it.
Simply stated, physicians predominantly practice where the money is. Thus, emergency departments serve as the major and most expensive source of primary care to the citizens of our state. Advanced practice nurses are fully qualified to provide primary care services to the people of Florida, but have been consistently held back by the Florida Medical Association lobby, which uses money and scare tactics to bully legislators into a state of inertia when it comes to prescriptive privileges for ARNPs.
Then two things legislators understand: money and numbers. And thank God we have both. Not only we have both, but people are beginning to understand that we are the answer to the healthcare crisis that we have in the United States. That's where it is at, prevention. And who better does prevention than nurse practitioners and nurses?
15 years ago, I moved to Tallahassee and had a variety of something wrong, and nobody could figure it out. My nurse practitioner did.
Really, what gave me the passion for this rally and this cause is that my mother spent the last 6 hours of her life short of breath because the main caretaker or care provider in the nursing home was a nurse practitioner, and we had to wait till 5 p.m. for the doc to sign the morphine prescription. And that's happening all over the state.
You were trained to do good things for people, and we need to allow you to do all that you can do. And Florida being one of only 2 remaining states that are being illogically stubborn on this issue of allowing you to do all that you can do with good patient care, good efficient care, good compassionate patient care, which is what nurses know how to do best, this foolishness has got to stop.
But as president of the Convenient Care Association, I'm representing over 1,200 retail clinics across the country that employ 10,000 nurse practitioners, about 1,000 here in Florida, who every day are changing the face of healthcare delivery. It's about the right provider, which is you, and the right place, delivering the right services at the right cost. And let me tell you, this model has resonated with customers.
All right, Representative Hudson, we need to thank him for taking the opportunity to be able to introduce us to all of his colleagues on the House floor.
I would like you to work in conjunctions with your colleagues at FNA to continue to strive for ARNP controlled substance prescribing and to work together after session, during the election season, and leading into next year's session, because as a united voice, we can make this happen.
It's become increasingly frustrating to not be able to provide full service medications that our patients need.
The time has come, especially in light of the healthcare reform. You know, we're all about saving money and all that. And, you know, how can we best do that?
We're here today because we're rallying for, our patients first. Because us nurse practitioners here in the state of Florida are not allowed to prescribe for narcotics. And that's one of the big issues we have. We have only 2 states, Florida and Alabama, waiting to pass the bill.